So one could be exogenous testosterone. If I stop, will I still feel optimal as I did before? The British Society of Sexual Medicine says no, because you can start someone with testosterone. It does give them the push, the impetus to go and do the exercise. You might find that if you're on the keto diet or you're changing your lifestyle and really getting the sperm production is dependent on the testosterone that's made in the testes. Declining a lower testosterone level and a higher LH level, you know it's only a matter of time before that thing's going to probably burn out. And we know there was a big study, I think over 5,000 men who already had heart disease, E1, E2, E3. These are different subtypes of, and the big one we look at is estradiol, estradiol, and that one is so important. You have to have it all in balance. That's why we call it balance for hormones. I've been on testosterone for 30 years, testosterone treatment of some kind, and I had all those questions as well. I also had questions that other people ask is, at what level, like when do I know I need to be on testosterone, and is this right? And what I can tell you what I've learned over the years is that, testosterone is that one biomarker that it's kind of a general headline of what's going on with your health in general. So if you had to pick one, is it cholesterol? No. Is it liver function? That's important, but no. Is it hemoglobin, hematocrit? Those are all important. But the one factor that looks at how healthy a man or a woman is how optimal their testosterone level is. But as I know it's a very general term, testosterone is the headline, but the real story goes below that. And what I mean by that is, some of you guys have shown me your testosterone numbers, your testosterone levels, and am I a candidate? Am I not a candidate? Well, it's like a multi-layer cake to know whether you're a candidate for TRT. One, most guys who come to us at BMH at an online clinic, they're really desperate. No one believes them. They have some symptoms, and it's really symptom driven. And the top ones, the top tier ones, are the sexual symptoms. But when they've reached those sexual symptoms, like not getting noticeable morning erections, difficulty achieving an erection, and keeping one. There's difficulty in having a desire, for a drive for life and just a libido desire, a sexual desire. Those are the ones that some of the societies and I will say those are the must have. But it's a bit more nuanced than that, because you can have other symptoms that aren't sexual that start when the levels are even a little bit higher and are falling for some men. Some symptoms we know can start with testosterone levels as high as about 15 nanomolars per liter, so around the 500 nanograms per deciliter mark. And so do you wait until those levels drop so low till you have all the serious sexual side effects? Or is it okay to look a little bit higher in some cases? And so that's where a lot of the debate comes in the TRT world. We were in an article that was a hit piece by the Daily Fail. I don't know if anyone saw the Daily Mail in the UK. It's kind of a bit of a rag, kind of a yellow journalism, I think they call it. And and the guy came through as a patient, and he wanted to see came to our clinic, came to some other clinics, and wanted to see what these clinics are doing. And there are ads on the tube now saying, do you have low testosterone? Do you have these symptoms? And they're trying to get people in. And his mind, and as a lot of people who don't know, think, oh, well, these people are just trying to make money off of me. They're just trying to get me to be on testosterone, and they'll come up with any way they can. And so I think that's how his approach was in the article. And he cited some of the other companies. He came through, his levels were, we get the patients that are desperate. No one's helped them. They don't understand. So our doctors picked up on that, and they wouldn't prescribe him testosterone. And he did, in the article, mention out of all the clinics that he went to, only Balance My Hormones had the most thorough consultation, very in-depth analysis of his blood test, very in-depth understanding, and didn't offer him testosterone. Now, what our doctor did offer him, but suggest, whilst testosterone was an option, is an option for some patients, not this patient in particular, and other patients, sometimes you can try to boost the levels of testosterone. You might find that if you're on the keto diet or you're changing your lifestyle and really getting back to the basics, you can, on your own, raise testosterone levels. Now, I know that sounds strange for the guy that, we offer testosterone treatment, but it's not just testosterone. We're trying to improve the quality of everyone's life. And sometimes just, if you don't need to be on testosterone, if there are ways you can manage and improve the quality of life, then yeah, that's great. And then, over time, as we get older, there's a combination of factors that will affect how you make testosterone. So there could be factors that affect the way the brain releases a signal to make more testosterone. It could be the testosterone factory themselves. Your testes can get knackered, oxidative stress, things that we go through in life that they may not produce as efficiently the amount of testosterone that you would have had when you were younger. So anyway, that was kind of what I was kind of just general points about testosterone health and the fear factor that some men will have. So when you go through all the diagnostic tests that you have to do for treatment, like you'll have to have, we say 2 blood tests. Now I think in the US, some of these clinics are getting away with 1 blood test. And the reason why we think 2 might be better is it's not to sell more blood tests. Believe me, if I can get people through on no blood test, just based on symptoms like they do for women on HRT, from a business point of view, that's fantastic. But in reality, there's a big, I don't know if guys who aren't on testosterone, but there's a lot that you probably think about, okay, I've got to be on this for the rest of my life. I mean, you don't have to be, but the thought is, if I stop, will I still feel optimal as I did before? If I get a taste of having slightly higher levels, am I going to enjoy?
That feeling's addictive.
Yeah, am I going to enjoy? Because we know that depending on the testosterone treatment, injections, whether it's a microdose, meaning a dose less than the normal 200 milligrams that you get, but you get essentially a bolus dose. You get this dose, it increases the levels quite quickly. And that increase in testosterone affects your dopamine receptors, right? It can affect your serotonin receptors. You feel good. You feel good with this surge of testosterone, which is why some men, when they first start treatment, they'll have that honeymoon period, we call it, where they feel great for the first 2 or 3 weeks, and then they'll say, oh, I'm not feeling like I did initially. And like anything that boosts dopamine, this is my thoughts, and I think others have agreed, when you increase dopamine, whether it's a dopamine agonist or if you're on something like bupropion, you reach a steady state, like your body becomes accustomed to that new level of dopamine. People with Parkinson's disease, they'll go on levodopa to fix the symptoms, but it just kind of plateaus unless they keep adding to the dose, because your receptors get used to that amount. So in the brain, but that's how you should normally feel. But it doesn't, so you wouldn't expect a massive high and a rush all the time. It's just because you went from such a low baseline to starting to feel optimal, and part of that would be due to the dopamine response, and then your body getting acclimatized to having optimal normal levels. But even if you get to that plateau at that 2 or 3 or 4 week period, you shouldn't be chasing the dragon. You should be looking at what are the metabolic factors that are what are you improving metabolically by being on this hormone? How are you strengthening the body by having the hormone at an optimal level? And it does really buffer you. So I've seen natural guys, I try to be natural, unnatural, I don't mean to put it in that context, it's so binary, but guys who really struggle at the gym goers, and they watch everything they eat, and you get a bit of creatine, and if I don't train for a couple of days, then I just deflate. And you don't always see that with testosterone. I've heard from the similar guys who would have low testosterone levels, training, everything was just as it should be, kept journals and logs and weighed the food, but didn't notice really much at all as far as muscle gain and fat loss, but they had low levels. And then when they finally realized they had low levels, they get on treatment, and 6 weeks to 6 months, they come back and they'll say, I didn't really change anything from my training to my diet to my exercise, and all of a sudden now with this testosterone, I've seen an improvement in muscle mass, a decrease in body fat, my mood's fantastic, and my libido's through the roof. We get a lot of those stories from those guys, and it's interesting because from that subset of patients who were doing everything right before, it wouldn't nudge up their own natural testosterone levels, and it wouldn't really change their body composition. They are seeing an effect on the treatment and doing everything right. But then you also have some patients who were a bit sedentary, they didn't, they're busy, stressful lives, and they start treatment, and it does help, but the they don't get they don't optimize as they should because they're not doing those other very important things. And we try to get our patients, but you can't force people to do things that they're not used to. There's another group of patients that will start, and again, they were sedentary, they didn't do it, but then they got that extra testosterone. And in many cases, it will push them to maybe start a gym program and to start saying, okay, now I'm taking care of myself and I'm going to do these things right.
That's what you should do first, is diet and train, and then the retest.
Yeah, so there was the European I think Endocrine Society, for people who are overweight or obese, their argument was you get the weight down, see if the testosterone goes up, then put them on testosterone. The British Society of Sexual Medicine says no, because you can start someone with testosterone. It does give them the push, the impetus to go and do the exercise, because you can really get burnt out by not seeing the progress in the gym, and then you end up giving up on it anyway, and you've lost all that time and potential harm to your health. So that's one way to look at it. So that's kind of my thought. But the thought about the article, and getting back to, there is an attitude in society still in 2026 about who should go on testosterone, at what level should they be at, and this is quite frustrating, especially for people in the general public or those who are thinking about being on testosterone, because they're looking at it the wrong way. The question should be, how damaging is having suboptimal testosterone to the quality of life, and to your health? I mean, we know there was a big study, I think over 5,000 men who already had heart disease, okay? And they were put on testosterone gel. We could argue testosterone gel is a lot weaker than injections. Sometimes it doesn't touch the side. Sometimes it's very hard to measure the effect of the testosterone gel. I mean, we've had some patients on testosterone gel, and if you time them right with the blood test, you can see they are getting okay levels, but the vast majority of them don't, which is why testosterone creams, and the difference between gels and creams, the gels are very low, weak, maybe 5% concentration. Creams are bespoke, 20% concentration of testosterone in it. You can apply it to your scrotum, where the gel has alcohol base and it will burn your scrotum. I guess if you have a strong constitution, you might be able to get away with it. You don't mind the burning, but the cream is designed for scrotal application, and you get a little added bonus of the DHT. So those are some of the treatment options with that. One thing that I got to tell about the DHT, what that is. So I think I was saying before, testosterone is 3 drugs for the price of 1. You get dihydrotestosterone, which is DHT, which affects your growth of your beard, your sexual organs. It helps with anxiety. It is the one that in some cases is somehow implicated with hair loss, but it's not that simple, just the DHT. But it seems sometimes when it's inhibited or blocked at the receptor, then sometimes people can minimize the hair loss, but it's not really a good approach to block DHT because you need it. So, and then the other one is estrogen in America, estradiol, estrogen. So estrogen and estrogen is the general female hormone. It's considered a female hormone, but men have it as well. And there's different types of estrogen, like estradiol, and there's different like E1, E2, E3. These are different subtypes of, and the big one we look at is estradiol, and that one is so important. You have to have it all in balance. That's why we call it balance for hormones. So having the right amount of testosterone, the right amount of estradiol, the right amount of DHT is really important to feeling healthy and on your treatment. And there's some other things that are affected as well, like DHEA, pregnenolone. These are adrenal hormones that you make. So I guess the whole point of the talk was to give you guys a broad picture of what it's like to be a 30-year-old, I'm not 30 years old, a 52-year-old man that's been on TRT since about the age of 22. And some of the things I've come across, both as a patient, because I've had the same fears and anxieties at certain times, like, at first I was really excited that my doctor was going to put me on testosterone treatment. Having gone to like 10 different doctors, getting many different blood tests. And this was 1996, and there were many that just dismissed me.
Could you tell us what the dangers are not just
Yeah.
erections and
The dangers of having low testosterone.
yeah, like on your heart.
So actually there are dangers, and sorry, I'll go back to the Traverse study and I'll tell you. So this is where it's talking about the dangers. So they looked at men with the cardiovascular disease, they gave them the testosterone gel, and they found out that actually these men did not die of heart attacks, they did not die of prostate cancer, it did not worsen it at all by having testosterone gel added to them. That's thank you, Alex, I forgot. And so the Traverse study, it kind of shut the door on this fear of using hormones, because for so many years, back in '96 when I was going through, the reason I had to go to so many doctors, because there weren't many doctors then that understood the benefits of testosterone, especially in a younger person, and they were more concerned about the fear. I got the fear mongering, you'll get cancer, you'll have heart disease, all the, it's not true anymore. And the same, we don't know if that's the same for massive anabolic steroid doses. We do know that might create hypertrophy in the chambers of the heart, may throw off your lipid balance in the right way, maybe increase inflammation. But anyway, some of the dangers are, there's a theoretical danger that if your testosterone level gets, well, we're talking about the dangers of being too low. If your levels are too low, there have been some studies in 2017, 2018 that looked at prostate cancer, and that the men that had the lowest levels of testosterone in the study had the most malignant forms of prostate cancer. So more aggressive forms of prostate cancer and that's believed by Dr. Abraham Morgentaler from Harvard University, that came up with what's called the saturation model. So that if there is a cancer that grows, it's usually growing starting at lower levels, like 265, I think, is where the cutoff, and above that level, or maybe above 265, then above that level, there's no more. It's already saturated, or maybe 300. But there's a certain threshold at which it's more dangerous to have lower levels of testosterone. So what else? I mean, the dangers of low testosterone could be metabolic disease. I've seen men that start on testosterone treatment, they come off testosterone treatment, say, oh yeah, mentally I got through it, I'm okay. And I got this paunch, I got this extra visceral and midsection body fat, from going off it. But mentally I'm okay, but this isn't good. If they were more lean before, now they've added this, well, there are repercussions of not having optimal levels of testosterone, or having optimal levels of testosterone and then going off of it. There's one doctor I had on my channel years ago, Dr. Adams, from Canada. Poor guy's got, I think he's got Parkinson's now. But we edited the video really well, so he didn't, you couldn't tell in the video, but because you had a lot of, it's hard for people with Parkinson's to get all the words out. He said, we had a subset of patients that he would treat with testosterone treatment, and they thought, well, I'm fine, I'm going to stop. I have had enough, I don't need any more. And then, because they had erectile dysfunction coming into that, this testosterone treatment, even with a little bit of tadalafil, helped fix it, and then they stopped the treatment. And he said it was a lot harder for them when they restart, because the erectile dysfunction came back, and it was a lot harder for them to restart and get that erectile function back, because they may have caused additional damage by having the low levels of testosterone. And it could also happen with Peyronie's disease, the curvature of the penis. It can happen for different reasons, but one of them is the morning erections, and the testosterone, refills the penis and helps prevent any sort of fibrosis. And if you're not getting that strong morning erection or erections at all, that could be a bit damaging, down there. And then, erectile dysfunction itself is a canary in the coal mine for cardiovascular issues. So it's not just a matter of, hey, sex, I want to have a good sex drive and good muscles. This covers the whole body, and the mental health aspects of low testosterone. Some men could have, either suicidal ideation or other issues with their mental health, depression, anxiety. So it's really important to have kind of those in balance. If you like content like this, do click like and subscribe, and hit the notification bell if you want to get our latest updates for when we drop content. It really does mean a lot. And until next time, to your wellness, this is Mike.